everyone is in. My name is Melissa. I am filling in for Tina Barona today. We are hosting the briefing to talk about hospital capacity, and I'm going to turn things over to our Chief Clinical Officer, Ajay Kumar.
Good morning, everybody. I hope everybody's doing well. We have our team assembled today to answer your questions, whether it's about how we're managing the capacity at the moment or update on our new antivirals and monoclonal antibody and other precautions we're taking in terms of safety and education to the community, and answer any questions you have. To begin the conversation, I'll give you an update on the numbers of patients we have right now in Hartford HealthCare. We have 206 COVID patients in acute facilities today. 24 patients in Bacchus Hospital. Charlotte Hungerford has 19 patients. Hartford Hospital has 61 patients. Mid-State Medical Center has 18 patients. St. Vincent Medical Center has 20. Hospital Center Connecticut has 47. Wyndham has 14, and Natchag Hospital has 3 patients. It's really important to note that the numbers are exactly where we were in Feb of 2021, somewhere around 14th or 15th of Feb. And if you track back in the previous surge models, the last time when we had this number was back in November of 2020, about 200 patients. And prior to that was an initial surge, which was back in early part of late part of the March in 2020. So we're seeing this increased numbers, and we're noticing it across Connecticut as well. Interestingly, the trend in the numbers has not changed in terms of types of patients. Largely unvaccinated patients who are coming in. We have about 24 to 26% vaccinated individuals are getting admitted as well. Most of them are incidental findings, but they happen to be vaccinated. We are seeing a similar trend in mortality, higher in unvaccinated individuals and less in vaccinated individuals as well. So we're watching the numbers. Hartford HealthCare, among the 7 hospitals and as integrated, we are managing capacity rather well at the moment. We don't expect any issues with access to our patients or any issues with our inpatient admissions or procedures. Our models are still evolving, given Omicron is rather new, and we're still learning about this virus every single day. We think this is probably related to the cold weather, possible Thanksgiving gathering, possible increased travel, and some decreased compliance with the mask in community. And this will plateau out and will be controlled. We might see some more increase, but most likely we'll be able to weather the storm this time as a healthcare system. We're pretty confident in our precautions and safety procedures, our policies, and other things we're doing in Hartford HealthCare. We also have visitations open for our patients with family members. We intend to continue at this time. No significant change in our policies. I'm proud of the teams in Hartford HealthCare. We continue to follow the precautions around the mask wearing, social distancing, and the healthcare community is ready to serve the state of Connecticut as always. With that, I'm going to pass on to my colleague, Eric Arlia, to begin with, and he will comment on status of antiviral and monoclonal, and Dr. Ulysses Wu will talk a little bit about Omicron after that. Eric?
Thank you, Dr. Kumar. Good morning, everybody. So we can start out by talking about the antivirals. Really not much of an update from our call last week. The molnupiravir, which is the one from Merck, was reviewed by the FDA on November 30th. We have not seen an emergency use authorization released yet. I believe it could come at any time at this point. I mentioned on our call last week that we had a preliminary call with the Connecticut Hospital Association on how we might receive and distribute that medication. I think once it receives emergency use authorization, there'll probably be a few weeks of small, low supply, and there'll probably be some pretty significant restrictions on use. And then over time, I expect that it will be loosened, and they'll be able to be provided in more locations and to a wider population of people who are COVID positive. The Pfizer drug, which is known as Paxlovid, We still are waiting for the FDA to schedule a hearing with their scientific advisory committee. So again, there's a lot of information out there that there's desire to do that this month in December. So, we're watching on a regular basis to see when those things occur. I think that is part of our thought here at Hartford HealthCare about really looking at how we manage COVID for outpatients, and it'll play into a lot of work that all of us on this call are doing, trying to find ways to very quickly manage patients who don't need to come to the hospital or to the emergency room, but might benefit from these new therapies that are coming out. So that's something you'll hear more about from us in the near future. As far as boosters go, again, like we said last week, the Delta variant is what we have in front of us today. We all strongly believe that getting a booster is our best defense for that. We continue to review our appointments here at Hartford HealthCare. I see this morning that many of our sites have appointments available over the next 10 days. So I continue to encourage everyone to consider getting a booster. As we start to learn more about Omicron, in these first few weeks, I think you'll find information as it comes out, will impact how we feel about it. We got our first press release from Pfizer yesterday showing that with a booster, there's a significant increase in antibodies, up to a 25-fold increase, and they are effective against the Omicron variant. So while we won't know everything about Omicron probably for at least a few more weeks, this first piece of evidence that we have, in my mind, just makes it more compelling to get a booster now. Today is December 9th. We still have about 2 weeks before Christmas. People who get boosters over the next few days still will have full coverage from the booster in time for Christmas gatherings. So again, that's our number one push for today. That's the one thing people can do today, if they haven't already done so, to most protect themselves and the people around them. As far as the monoclonal antibodies go, supply remains strong with those. We haven't seen any supply constraint issues. I will note that yesterday a new monoclonal antibody received emergency use authorization from the FDA. This one's from AstraZeneca. This one's a little bit different. This one is really meant for people who are unable to be vaccinated, people who perhaps have severe reactions to vaccines, or for people who are unable to elicit any kind of an immune response. So this one's going to be used much differently than the others. It'll be for people in those populations, and the hope is that they can get coverage, some protection for up to 6 months. I'm waiting to hear when we'll be able to receive an allocation of that. I would expect, since the emergency use came out yesterday, that we'll probably hear in the next few days if some of that drug will be available to us. And then if it is, we will incorporate it into our logistics and planning for caring for people in the outpatient setting. So that's a therapeutic update. So I will pass it over to Dr. Wu to talk more about the Omicron variant.
Thank you, Eric. Thank you very much. Before I dive into Omicron, I'd like to really touch base on a couple things that Dr. Kumar had mentioned about Delta, because Delta is the demon that we're dealing with at this point. We have waxed ad nauseum about vaccinations and boosters and masking as the way out of this pandemic. And at many times we suspect that maybe we're preaching to the choir. And so I'm trying to think of a different way to develop this message. And really the way to look at coronavirus is that it is a social disease. And what do I mean by that? What do I mean by it being a social virus? It is transmitted through our own social behaviors, and we have to be very cautious about how we approach things. This is a respiratory disease that is obviously transmitted through the respiratory route. And with masking and vaccination, that certainly serves as the first line of protection. But really, the best way to beat this at this time is to try to figure out how do we modify our own social behaviors to not put ourselves at risk. This is not only going to hold true for Delta, but it is also going to hold true for Omicron as well. So let's dive into Omicron very briefly. Not much has changed since we've last talked about this. We we know a little bit more, and in the sense that it confirms a lot of the things that we had talked about. It is more likely to be transmissible at this time, and it may have the ability to evade the immune system. And so what do I mean by that? Vaccines, I think, will be effective, but maybe not as effective against Omicron. And that's why when we talk about getting boosters, there's some of the good data that says getting boosters will be your best protection against it. With regards to other evasion of the immune system, we seem to notice that those who have had COVID before have gotten reinfected as well. So one more reason for them to get boosters in addition to having had natural illness. With regards to the therapies and medications against it, we don't think that there's going to be a drop off with any of our monoclonals at this time, or any of the antivirals that we use in-house. But I think it's still a lot needs to be studied about that. In terms of its virulence or its ability to cause disease, or how severe its ability to cause severe disease, the preliminary findings are very good, but I want to caution everybody that we can't still extrapolate too much, because that's a different cohort. In South Africa, the cohort that we were looking at, they tended to be younger, who they don't tend to get as sick as usual. Some of them have been vaccinated as well. The hope, and I do pray for this, is that it is a more mild disease. But we are approaching Omicron at this point that it is still going to be a deadly disease. We are not resting on our laurels. We are not taking a break from this. Hartford HealthCare is certainly we're doing everything possible, but I'm going to say that we're not going to change anything because of Omicron, because all of those measures have been in place for Delta. So it does not going to change our approach. With regards to our ability to deliver outpatient therapies to patients, we are streamlining the process so we can create greater efficiencies to be able to get these oral monoclonals to patients, to be able to get monoclonal, I shouldn't say oral monoclonal, oral COVID pills to patients, and to infuse a greater number of patients with our monoclonals as well. But I don't want to get away from the epidemiology that Delta is the beast that we're dealing with right now. And as you all have known on all my media appearances, there's always one pop culture movie reference. And at this time, everybody's got their eye focused on Omicron. They're focused on, the boogeyman outside of the house. But there's that movie that says, oh, I'm calling from inside the house, and that's Delta. And we still need to keep our eyes open for that. So with that, I'm going to pass it over to Keith Grant.
Morning, guys. I agree with everything that's been said. I think, the epidemiology speaks for itself right now. We have a significant increase in hospitalizations across the state. We have an increase in prevalence as well. We continue to see a very specific population that's been hospitalized, to include individuals in the critical care. So individuals over 65, we have, our breakthrough cases continue to be between 20 and about 30% across not just our system, but across the state. And the majority of individuals that are in critical care are individuals that are not vaccinated. I think critical care numbers at this point in time is anywhere between 1 to 7% across the state. That's where it's looking. So individuals that are intubated. Additionally, I want to agree specifically with the conversation about focusing on kind of the variant that's here right now. So Delta variant has done a significant number on this population, not just in Connecticut, not just from Hartford HealthCare's perspective, but globally. And I think the numbers that we're seeing right now is, we're confident that is attributed to a significant part to the variant that we're dealing with, which is Delta, not Omicron. The good news that Eric spoke about regarding Pfizer's study, very, very good news. But as stated before, all it does, it expands the conversation that we've been having, the importance of vaccination and the importance of booster. Additionally, what we need to do to continue to move forward away from this disease process is very consistent with what we've been saying for weeks on end, which is appreciate the risk that exists within the social environment as we socialize through this holiday season. appreciate that there is going to be changes and higher risk with individuals now being inside more because of the change in weather, and appreciate the importance of mitigation strategies such as social distancing when necessary, masking when necessary, and if you're symptomatic, try to get tested as soon as possible. I do believe that there is not much that we can conclude on an Omicron at this point in time. But if the data that we're looking at, or the data that we have an opportunity to see with a very limited cohort, it seems like it is possibly less virulent, might be more contagious. But again, those key terms that I've used is possible and might. And but if we're able to conclude that at some point in time, we'll have data that we're able to talk about more publicly. As it stands right now, as stated before, we have a lot of work to do with Delta variant, and we'll continue to provide information and access through Hartford HealthCare as much as possible, as soon as possible. That's all I have.
So we have a few questions. Tracy O'Shaughnessy asks, the US has distributed 200 million vaccines and more than 80% of Connecticut has received just one shot. Yet we are at the same number of patients we were when we didn't have access to vaccines. How is that possible?
Ulysses, you want to take this on?
Yes, absolutely. So it's exactly what I was talking about earlier. It is the social behaviors that is resulting into this. We've always maintained that the more people that can get vaccinated, the better, but we're really not going to achieve that scale that we would like to until we get above the 90% mark with vaccination. So if you have a 70% fully vaccinated population, but 30% are still unvaccinated, you're still going to have these issues. Now, we do have to remember that, and as we've always said, vaccination is not necessarily to prevent disease. That is an added side benefit, but it is to also keep people out of the hospital. And so we know that people are showing up into the hospital. And I do want to give some trends in terms of the state where our trends are. And we've noticed over the past few weeks that it is an increasing amount of people that are unvaccinated. So before, when we were closer to the high 20s, and 30% of vaccinated people who are in the hospital, that has actually dropped to almost 20% at this point. So I think the vaccine is doing its job. I think people getting their boosters are doing its job, but it is unfortunate. And yes, I think we are all aware that our 2021 deaths have surpassed 2020 deaths. And so it does beg the question, are we doing better? And I think we are doing better. I think more people are getting infected, and a lot of it is due to social behaviors and COVID fatigue.
The other thing to think about is the fact that the Delta variant dominates 2021. And over the last, I'd say 4 or 5 months, Delta variant in most studies, hundreds of times more contagious than Alpha variant. So we have a disease process that is significantly more contagious. We also have in many communities, people aren't as vigilant as they were before. And that's one of the reasons why our message is very consistent. The disease is still here, it's still deadly. There's still about 860 people that's dying in the US from COVID-19 daily. So it's alarming statistics. So this is still a deadly disease. It's still the Delta variant, as I said before, it is significantly more contagious than the variant we had before. So I do appreciate the impact of the vaccinations, but the epidemiology as it stands before is a reflection of really what Ulysses has talked about as our social behavior at this point in time.
Eric, are you okay? Melissa, if I can just ask Eric to comment on the boosters and Alex's questions regarding the criteria of the monoclonal, and I'll go back to Aaron's question later on. So let Eric explain both those things.
Okay.
Can you re-ask that question?
Which question is it?
Tracy's question is, have you seen an increase in number of folks getting either the first dose or boosters? And Alex has a question, have we changed Hartford HealthCare criteria for prescribing monoclonal antibodies?
Sure. So I do think we've seen an increase in booster appointments. Most of our clinics, by the time we get to the day of the clinic, are close to or at 100% full. It's nowhere near what it was at the beginning of 2021 when people were getting the original series. The number of people getting the original series from us is very small, but not zero. All of our clinics continue to offer the original series and then have those follow-up appointments 21 or 28 days later. So definitely a little bit of an increase. As I've mentioned before, we're always watching the schedule. And if we see it fill up, we do try to add appointments at different sites as needed. The criteria for the monoclonals at this point in time, it is not changing. We're following the emergency use authorization guidelines from the FDA. You might have heard Ulysses mention that we're looking at ways that we can make our own process of administering them more efficient. There are no supply constraints at this time. We would like to continue to just follow the EUA and just figure out ways that we can treat more people as the demand has increased pretty significantly over the last 2 months.
So let me go back to Aaron's question. Given the increase in hospitalization in Connecticut and around the country, what do the capacity look like in your system, and are you making any plans in the event that hospitalization continues to increase? Aaron, we're always in the state of readiness and preparedness in Hartford HealthCare from the beginning of the pandemic. At the moment, at this time, we don't have any issue with access or any challenges with that part here right now. We do expect some tightening in the winter. It's been happening with or without COVID. It's been, as long as I've been here in Connecticut 10 years, and I've noticed every single winter, we actually have increased number of patients coming in. Interestingly, largely this year, our hospitalization was replaced by other respiratory illnesses to COVID, not so much influenza, which is coming in the hospital right now, but the COVID. So the kind of, it's a swap to a certain extent at this moment, at least right now. But we are assessing every single day, and obviously, I will react accordingly. Our goal is always to make sure that the community has an access to the healthcare, and we are able to provide whatever is needed at the time for the patients to care for. So we'll be ready in whatever needs to be done. But right now, we don't have any plan of changing a course. Tracy has a question. You've talked about preaching to the choir and messaging. I'm curious about the unvaccinated patients who come in. Do you offer them vaccines after they've been discharged? Have any of them come out in support of vaccine after their discharge? And sorry for the caps. Melissa, I hope you're okay from reading the questions. I just
Totally fine.
trying to direct those. Maybe I can have this refer to Keith. Keith, maybe you can talk about this.
Where to start? So, we actually, yesterday, we had a really good conversation with a number of community leaders about this very conversation. And the challenging thing for, I think, healthcare, and it's not just Hartford HealthCare, it's not just in Connecticut. The challenging thing, I think, for us is discovering the specific needs of specific communities with getting education to them, with getting their definition of what access truly is. And it's not just isolated to vaccinations. So there's significant work that's been done in this space. There's a significant commitment from Hartford HealthCare and many other communities of healthcare systems to get this, to learn from this actual process itself. What I will say is, what happened with COVID-19 and the impact it has in certain communities, and what we've seen with how vaccination has been received in certain communities. We realize that there's a enormous opportunity for us to potentially restructure how focused delivery of care happens, right? And there's a vision that Hartford HealthCare has, and we've had that before COVID-19, and it's to deliver personalized care in a way that it is high quality, best practice care. And that personalized care has never been more so than during COVID-19, where we realized that just getting information is not based on how much people sees the information, but how does Melissa and Tina and the team get to a specific community with a specific message that they need to hear in order to probably change their mind, not just about COVID-19, but about the trust that they have in the healthcare system, trust that they have in the availability of access. And I think the last thing I will say is, we've created, I think, more of a feedback loop now that we're getting more information from the community saying, we should probably try this, or we should probably try that. And I think those things will lead us to be more successful in this space itself.
And I think that was an excellent summary by Keith. From a logistics standpoint, Hartford HealthCare does have a hospitalization vaccination program prior to discharge. It's fairly limited because there are very few indications to actually get the vaccination in the hospital. But with regards to have any of them come into support after the discharge, it's difficult to say because there's not much in terms of feedback with regards to their vaccination status once they leave.
Jordan is asking a question. Can you talk more about breakthrough data? Can you break it down by age? And the other question Jordan asked, just to clarify, the percentage of cases that are breakthrough has it decreased? Maybe I think Ulysses or Keith, you can both answer that. Maybe Keith, you want to take a shot at it?
Sure, I'll pull the data up right now. Current data that we have less than 30% of individuals that are admitted to the healthcare system currently are vaccinated. I think the data that we're always very interested in, and I'll tell you, why, is or critical care data, and specifically individuals that are vented within our system. So as it stands, there's one patient, 1%, less than 1% of individuals that is admitted in critical care, needing critical care, and is vented in our system that is COVID-19 and that is vaccinated. And the reason why, so the data regards to vaccinated individuals or true breakthrough cases, the reason why that data is not a good indication to judge efficacy of the vaccine itself is, Ulysses talks about this a lot. In what is the true goal of the actual vaccine itself? We have a number of these patients who are in the hospital that are have been vaccinated or updated on their vaccines, but are individuals who are here for something completely different, doesn't have COVID-19 symptoms, but because of the robust system that's set up at Hartford HealthCare, where every patient that comes in get tested, we'll find out that these individuals are positive and asymptomatic. So that's a good over 30 to 40% in most cases of these individuals. So again, the focus for us is our individuals that are in critical care and breakthrough cases, as well as individuals that are in critical care and that are intubated as well.
And Jordan, yes, the number has gone down from 30 to approximately just above 20% for vaccinated individuals. With regards to age, unfortunately, it still affects those, as Keith had talked about, with specific comorbidities in age, are still being disproportionately infected for those who are vaccinated.
Carry on, Melissa.
Got it, Ajay. Go for it. You're doing great.
Let me just take the next one. Tracy's asking a good question here. If you know that certain groups, including certain religious groups, have been anti-vaccination, how have you integrated your education to those denomination preachers? So Tracy, I don't consider the religious groups or anybody else as anti-vax. They're individuals actually who have a belief system rather than religion-based. At least that's my learning and understanding. With that said, Hartford HealthCare is a very inclusive, open model. We educate everybody. We provide the information. We meet people where they are, and hopefully folks actually make a decision based on their personal knowledge and belief and understandings on that part here. So we have been, our focus has been about the vaccine education is through the lens of empathy and compassion, and with providing an adequate amount of science and information, and remain available for answering questions. And we allow people to make decisions they'd like to make it. And I like to believe that we've been very successful given the number of Hartford HealthCare colleagues have been vaccinated. If I give you one number among the physicians and advanced practitioners across Hartford HealthCare, more than 99.4% of individuals have been vaccinated without us asking them to do so. So it's a model where education, information, and availability is the most important thing. I think I'm losing track of the question. Melissa, help me out. Are you saying those breakthrough cases in critical care are 1%? Keith, can you clarify the statement for Tracy?
So I typed that in. So 5% of the individuals that are here that are COVID-19 that are in critical care are breakthrough cases. And 1% of, we have 1% of that population that is vented.
Eric, maybe you want to take this next one. With the preliminary data showing the Pfizer booster works against Omicron, is that leading to increased demand for the Pfizer shot and more mixing and matching, even they didn't get Pfizer originally?
I think it's probably a little too early to tell if it's going to have an impact. I think, as I mentioned earlier, we are seeing an increase in appointments booked for the booster. That information just came out yesterday. I did notice when I was looking this morning that the Pfizer clinics are a little bit more booked than the Moderna clinics. So that's something that, our vaccine team will keep a close eye on. If perhaps with that news, there's more of a desire for a Pfizer booster, we'll adjust accordingly. We have the leeway. Everyone has the leeway with the guidance from the FDA to mix and match. So that's not necessarily a bad thing.
Thank you. Jordan is asking, I think Keith has answered Alex's question, so I'm going to skip that if that's okay with Alex. Jordan is asking a question, sorry, more clarity on breakthrough. Keith had said that all the breakthrough hospitalization, 30 to 40% are incidental, meaning they are in the hospital for another reason, but have been found to have COVID. Jordan, Keith, you want to answer that?
That is correct.
Yeah.
So off the population that we have of individuals that are breakthrough cases, about 30 to 40% of those individuals are in the hospital for reasons other than COVID-19 specific symptoms.
Tracy's asking, agreed, could we clarify on breakthrough? Tracy, can you be a bit more specific about your question? Or if that's easier, maybe you can just speak up and that might be helpful.
Sorry, I didn't get that.
Yes, sir, Dr. Kumar. I just want to make sure, because we've got a lot of percentages here, we've got a decrease of from about 30 to 20% of those of breakthrough infections. Of those 20%, 5% are in critical care, 1% of those are ventilated. That I believe that's correct. Is that correct?
That's correct.
And then
and we're talking, so there's a lot of percentages because we are talking about mixing of data. We're talking about state data as well as HHC data. So Keith is talking about HHC data for, with regards to the states, 19% currently are fully vaccinated and in the ICU.
Okay, so so what's confusing about that is if you're saying that you're down to 20% of patients with breakthrough infections are basically coming in, are vaccinated, but then you're saying that 30 to 40% are incidental. I'm not clear on that. Those differences, I wonder if you could articulate a little better, or maybe I'm just not understanding clearly.
So from the 206 patients that we have in-house right now that are COVID-19, about 30% of those individuals are consistently, well, over the last few months, what we've seen is anywhere between 20% to about 30% of individuals. Currently, we're about 30+% of these individuals that are breakthrough cases. So these are individuals who's been vaccinated and are current with their vaccination. So from that 206 patients as well, if you look at the individuals that are in critical care, it's 5% of those individuals that are in critical care that are breakthrough cases. From the individuals that are in critical care and vented, that's 1%. But if you look at the overall 206 patients that are here that are breakthrough, that are COVID positive patients, of the 206 patients that are COVID positive patients, if we look at it just for specific breakthrough cases, and identify individuals that have symptoms that are consistent with COVID-19, we realize that it's only about 30 to 40% of those individuals that fall within that category.
Let's see if that's helpful. We can take it offline and have a conversation with you and explain to you the numbers one more time. Unless the rest of the group also desires the same clarity. I think Keith has provided a fair amount of information on that. Tracy, would that be all right if we chat with you later on? Because I think either we are confusing you with the numbers or you're not able to understand the numbers we are trying to advise you.
Yeah, I could just write them down and send it out.
Thank you.
Yeah.
Very good. Let's say you want to follow up with any further questions or anything else.
If you want to, I don't know, Ajay, if you want to give any final thoughts or if we're good to go.
I think my final thoughts would be that the message I think all of us needs to convey to at this time, the vaccines are protective. and protect you from dying. Boosters are more important now than ever before, given the Omicron, which is coming on shore. We have access for the boosters, and we have access for the vaccination for the community. Hartford HealthCare is open and accessible. We are not we're not in crisis mode. We are in the place where we are managing well. Our visitors are welcome, and we continue to take the same safety precautions. We've been doing it for several years now, and our focus is always going to remain safety for our colleagues who work in Hartford HealthCare, for our doctors and nurses and respiratory therapists and environmental services and everybody else, and the safety for the patients and their family members. Our team's mission is to educate, provide information, be there for the community, and we'll continue to do so at this time. And I hope that's helpful for everybody. Happy to entertain any questions and ask you, Lisa, to comment anything else you have something to share.
Absolutely. So I think there are two more questions really quickly. So just Tracy, last time, the 20% comes from state ICU vaccinated patients. That's different from our numbers, which are lower. So that's where the 20% comes from. Jordan, to answer your question, how will Omicron affect breakthrough cases? It is unknown. It does have the potential ability to evade immunity at this point. And so it may increase breakthrough cases. But if it is more mild, the hope is that those breakthrough cases occur outside of the hospital, that they don't come in through the hospital at this point. And in terms of my summary, I kind of did my summary in the beginning where, the messaging for vaccinations and boosters and masking is what we're going to continue to promote. That is our only pathway out of this pandemic at this point. But the last thing, which we have been preaching for quite some time, is our risky social behaviors. We have to make sure we put ourselves in safer situations, that we don't engage where there may be a moment where we can not only acquire COVID and maybe we'll be asymptomatic, but also pass it on to those who may be less fortunate. Eric?
Yeah, I wanted to just leave everyone with a comment. Next Tuesday is the 14th of December, and that marks the 1-year anniversary of us receiving the first order of Pfizer vaccine. So really a historic moment. I think, when I look back at what we've done over the last year, we're always getting more information. We're always learning more about the vaccine. We're getting new therapeutics with monoclonals and soon to be oral medications. Our desire is to continually update all of you, to follow the science, create systems where we can maximize the community's access to all of these things, and really do our part to help us get through the pandemic. So it's just been an incredible year. I feel like I learn new things every week. It's incredible to see the scientific engine of the community and the pharmaceutical companies continue to provide us with more options to help care for everyone.
Keith, did you want to add anything?
Not much. Enjoy your family. Do so safely. I do think, there's a light at the end of the proverbial tunnel at this point in time. We understand much more about this disease process. I understand the anxiety that's around the Omicron variant, but the variant that is here right now, the Delta variant, it's predominant, and it's causing a lot of individuals, as you see, to be in the hospital at this point in time. So be safe, enjoy your holiday, and we'll keep you informed as much as possible.
All right. Thank you guys very much. And Ajay, thank you very much for being the masters of ceremonies today. So thank you.
Melissa.
Have a great
Thank you,
day.
everyone.
Okay.
Thank you.